Leukemia is a type of cancer that affects the blood and bone marrow. Bone marrow is where blood cells like white blood cells, red blood cells, and platelets are made. In leukemia, bone marrow starts making abnormal white blood cells called leukemia cells. They grow faster and don't stop growing. Over time, leukemia cells crowd out normal blood cells, and the blood can do its job. Leukemia cells spread to lymph nodes or other organs that cause swelling and pain. There are four types of leukemia: acute myelogenous leukemia, acute lymphocytic leukemia, chronic myelogenous leukemia, and chronic lymphocytic leukemia. Symptoms depend on the type of leukemia, but common symptoms include swollen gland, bleeding from gums or rectum, bruising easily, bone pain, night sweats, frequent fever, recent weight loss, fatigue, swelling on left side of the belly, and tiny red spots in the body. The risk factors for leukemia are exposure to high levels of radiation, chemotherapy, or radiation used to treat a previous cancer, and condition caused by abnormal chromosomes. Blood tests, cytogenetic analysis, immunophenotyping, transcription polymerase chain reaction tests, and bone marrow tests. These tests can help guide treatment. Other tests are performed. For example, chest x-rays. Chest x-ray find out if leukemia or infection is the cause of lung problems. CT scan of head, chest, and belly find out if leukemia has spread there. Lumbar puncture to see if leukemia cells are in your cerebrospinal fluid. MRI of the brain is to look into symptoms such as paralysis, confusion, numbness, vision problems, or headaches. It means the leukemia has spread to the brain. And biopsy of lymph node or tissue to find leukemia cells. Doctor determines treatment option based on age, health condition, the type of leukemia, and whether it has spread to other parts of the body. Chemotherapy is a major form of treatment. It uses chemicals to kill leukemia cells. Biological therapy, it works by using treatments that help immune system recognize and attack leukemia cells. Radiation therapy uses X-rays or other high-energy beams to damage leukemia cells and stop their growth. Stem cell transplant is a procedure to replace damaged bone marrow with healthy bone marrow. Before stem cell transplant, you receive high doses of chemotherapy or radiation therapy to destroy your damaged bone marrow. There is no known way to prevent most types of leukemia. Some types may be prevented by avoiding high doses of radiation, exposure to chemical benzene, smoking, and other tobacco use, or certain types of chemotherapy used to treat other types of cancer. In 2016, 60,140 people are expected to be diagnosed with leukemia. There are an estimated 345,422 people living with leukemia in the United States. The overall 5-year relative survival rate for leukemia increases gradually since 1960. In 2016, 24,400 people were expected to die from leukemia. In 2008 to 2012, leukemia was the most common cause of cancer deaths in men and 6 for women in the United States. Doctors are working to learn more about leukemia, the ways to prevent it, how to best treat it, and how to provide the best care to people with this disease. The following research that are being conducted are genetic research. Researchers are searching for specific genes or mutations that trigger the disease and which may be targeted by new drugs. Stem cell or bone marrow transplantation are being tested to increase use of this treatment option. New medications are being tested to help control the signs and symptoms. Clinical trials are finding better ways of reducing symptoms and side effects to improve patients' daily life.